Mr. President.
Senator from Iowa.
Mr. President, first I ask consent that Shauna Agan and Amber Oldham of my staff be granted 4 privileges for the duration of today's session.
Without objection.
Well, Mr. President, all 5 congressional committees involved in the health care reform debate have completed their work now. And the core elements of this landmark reform legislation are now clear. Now, the media have done a good job of reporting that the emerging bill will crack down on abuses by the health insurance companies. It will extend quality health coverage to the vast majority of Americans. Much attention has been paid to the public option, which I am confident will be in the bill that we send to the President later this year. So there's been a lot in the press about public option, about coverage, how much this costs, will there be an excise tax, what will the penalties be? Almost all of the debate that we see surrounding this, I shouldn't say the discussion surrounding the health care reform debate, is about how we pay the bills. When you think about it, it's about how are we going to pay all these bills? But there is one huge part of the health reform bill that's not being discussed very much, that I believe will have a transformative effect on the system that we have in America today, which I have often referred to not as a health care system, but a sick care system. When you think about it, that's what we have in America, a sick care system. If you get sick, you get care, one way or the other. But we do precious little to keep you healthy in the first place. As one of the comedians on one of these late night talk shows I happened to tune in one night said, you know, they're talking about everything except health care. What do we need to do to keep people healthy in the first place? Well, quite frankly, that's in our bill. And that's what I wanted to discuss this morning, is I wanted to discuss some of the aspects of the bill that I believe will really bend the cost curve in the future and make us a genuine wellness society. The bill that we reported out of our Health Committee creates a sharp new emphasis on fitness, physical activity, good nutrition, disease prevention. In short, just keeping people out of the hospital in the first place. This will give Americans access to a 21st century true health care system, preventing disease, helping us live healthy, active, productive lives. And it will reduce wasteful, avoidable costs that are built into our current system. Again, this sort of disease management approach that we have in our country now is just about patching things up after people develop a serious illness or a chronic condition. It's a system that overspends, which we know, and underperforms. It's been a colossal, expensive failure. Well, we can and must do better. As President Obama said in his speech to Congress back in February, he said, quote, "It's time to make the largest investment ever in preventative care, because that's one of the best ways to keep our people healthy and keep our costs under control." Well, Mr. President, to most of us, it's self-evident that cost-effective preventative services will save money in the long term. And this first chart, again, is a poll taken, and 76% of the American people said we should invest more in preventative care. 76%. They get it. American people get it. And this support comes across the political spectrum. 86% of Democrats, 71% of Republicans, 70% of independents say we should be spending more on prevention. This next chart shows that 77% of Americans support a new emphasis on prevention in a health care reform bill because they know it's the right thing to do. It's just common sense. If we can use cost-effective screenings, other upfront intervention programs to prevent tens of millions of occurrences of chronic diseases, such as cancer and diabetes, cardiovascular disease, well, it's self-evident. We're going to slash healthcare costs very significantly. Now, some critics have claimed that a new emphasis on wellness and prevention will cost more money and it'll drive up healthcare costs. To support this claim, they've created a straw man. They say we're going to do all these preventative services for everybody all the time, but that's not what's in our bill. I want to emphasize that our committee's bill takes a very rigorous approach to prevention. We target appropriate preventative services and screenings only to those segments of the population that are at a risk of a disease or condition. For example, under our bill, mammogram screenings would be free, no co-pays, no deductibles, but to those most at risk of breast cancer, women over the age of 40. Now, at every step, what we have relied on are the recommendations of the U.S. Preventative Services Task Force. This task force has been in existence since the early 1980s. It evaluates clinical services on the basis of scientific evidence related to effectiveness, appropriateness, and cost-effectiveness. So what we have said is if the U.S. Preventative Services Task Force gives a certain preventative measure, screening, an A or a B, then the insurance companies and providers must provide that without any co-pays or deductibles. So it's targeted. It's not everything, but we're targeting the most cost-effective. And we also say that this task force has to meet at least once every 5 years, take in the latest scientific evidence, make recommendations for revising the mix of clinical preventative services. So let me just review again some of the ways that the Senate Health Committee bill, in a very careful way, will put prevention and wellness at the very heart of health reform. First, we create a federal-level Prevention and Public Health Council to improve coordination among federal agencies in incorporating wellness into a national policy, a national prevention, a public health strategy. All of the departments should be doing this, not just the Department of Health and Human Services, but the Department of Agriculture, the Department of Defense, the Department of Veterans Affairs, the Department of Transportation, and on and on. All of them ought to have an integral part of their deliberations and their proposals for future legislation that they might propose here in the Congress, an element of prevention and wellness. We'll just take the Department of Transportation, for example. Are they really thinking about, when they are thinking about highways and bridges and roads and things like that, are they really thinking about bike paths and walking paths and sidewalks in cities that have to be incorporated into the planning if they want to get federal money? Well, they haven't so far. But this is what I mean. We need this kind of an overall coordinating council at the presidential, at the White House level, as I say, at the departmental level. We also start a prevention and public health investment fund to provide for expanded and sustained national investments in prevention programs and communities across America. In 2000, let me get these out of here. In a 2007 study by the Trust for America's Health found major savings from community-based. Now, there's clinical-based prevention, where you go in, you get a screening, but then there are community-based programs to improve physical activity, nutrition, reduce smoking rates, things like that. They found that a national investment of just $10 per person per year, think about that, $10 per person per year in certain community-based wellness programs would yield these kinds of savings. In the 1 to 2 years, $2.8 billion. 5 years, $16 billion. 10 to 20 years, $18.5 billion. So again, it's on both the community level and the clinical level. We provide for funding and a structure to make wellness and prevention an integral part of our healthcare system. For example, our bill would target nutrition counseling to pre-diabetic patients. Well, right now, under Medicare, for example, and most insurance companies, they will reimburse thousands of dollars to take care of your diabetic condition once you get diabetes. Now, they'll pay for amputating a foot or a leg. They'll pay for all these expensive things after you get diabetes. They'll pay for a lifetime of treatment. But now they will not reimburse for the cost of nutrition counseling for a few $100s for someone who's pre-diabetic and who could prevent the disease through changes in diet. Well, that doesn't make sense. So our bill would change this by requiring insurance plans to reimburse for nutrition counseling for pre-diabetic individuals. Another example of a cost-effective approach. Now, for essential screenings and annual physicals, our bill would get rid of copays and deductibles for things like your annual physical checkups, your vaccinations, mammogram screenings I mentioned, colonoscopies for the right population group, things like that. No copays, no deductibles. We're going to make major new investments in public health and the primary care workforce. Senator Murray of Washington did a great job of incorporating workforce developments in our committee bill. And a lot of that workforce development is in the area of primary care and preventative care and wellness. Finally, let me mention that our bill will give a powerful boost to employer-sponsored wellness programs. Our bill would allow employers to reward employees for participating in wellness programs by giving them a health insurance premium discount of up to 30%. In other words, if you participate in a wellness program that is provided by your employer, you can get a discount of up to 30% on your health insurance premium. This is something that has been done, I believe, by Safeway and others, and they've shown that they have had great results. People then can see the benefit of wellness and prevention by getting a reduction in their health care premiums. Workplace wellness programs, everything from nutrition counseling to smoking cessation, typically cost about $20 to $200 per employee per year. But again, they have a proven rate of return ranging from $2 to $10 within 18 months for every dollar spent. And if you don't believe me, just ask Pitney Bowes and what they did, or Safeway and what they did. And I just single those two out. Many companies have already gone way ahead of us in providing wellness programs to their employees. Now, are they doing it just out of sheer generosity? No, they know the bottom line. They know that if they provide wellness and prevention programs for their employees, their rate of return per dollar spent on employee is 2 to 10 times as much within just a year or two. They have healthier employees. They don't go to the hospital as often. They don't have chronic diseases. And they're more productive. They show up for work and they work and they're more productive. That's why companies do it. So what we've done in our bill is we've taken it and expanded this nationwide to give more companies the incentive to do that kind of thing. Our bill also directs the Center for Disease Control and Prevention to evaluate these wellness programs that are employer-based and to create an educational campaign to promote this workplace wellness throughout America. Well, we think about the United States and our health care or our sick care system, and think about it this way. We spend twice as much per capita on health care as European countries, twice as much. But we're twice as sick with chronic diseases. How is this possible? Well, the reason is clear. We have neglected wellness and disease prevention. 95% or 95 cents of every healthcare dollar is spent on treating illnesses and conditions after they occur. 2/3 of the increase in healthcare spending is due to increased prevalence of treated chronic disease. This chart kind of illustrates that. Back in the late 80s, we were spending about $313 billion a year on chronic disease. We've doubled that. It's now up to $627, and it's going up at an ever-increasing rate. Chronic diseases that are mostly preventable. And yet, we just continue to spend the money dealing with those chronic diseases. Now, the good news is that by reforming our system and keeping people healthy, preventing chronic illnesses, we have a great opportunity. Not only saving hundreds of billions of dollars, but improving the health of the American people. Right now, 75% of health care costs are accounted for by heart disease, diabetes, prostate cancer, breast cancer, and obesity, 5 of them. 5 diseases account for 75% of our health care costs. Now, what do they all kind of have in common? They all have in common this: they are largely preventable and even reversible by changes in nutrition, physical activity, and lifestyle. And again, for every dollar spent, 75 cents towards treating patients with chronic disease. The Center for Disease Control and Prevention said this, quote, "The United States cannot effectively address escalating health care costs without addressing the problem of chronic diseases." One more time. The United States cannot effectively address escalating health care costs without addressing the problem of chronic diseases. 96 cents of every Medicare dollar. You know, we always hear talking about how Medicare is going to go out of, we're not going to have enough money for Medicare in the next 12 years or 10 years or however long it is. Well, 96 cents goes for chronic disease. 96 cents. You want to cut down on how much money we spend on Medicare? Focus on prevention and wellness, especially for that group of individuals that are between 55 and 65 about ready to go on Medicare. Medicaid, 83 cents of every dollar spent on Medicaid, spent on chronic diseases. Why can't we get it right? Why don't we understand this? And yet, just like blind dodos, we say, well, we'll just keep spending the money on these and we won't address wellness and prevention. And we wonder why we can't get health care costs under control. Well, that's why. We're not addressing the underlying issues of wellness and prevention. So again, it just makes no sense to me that we spend all this time and all this effort to figure out a better way to pay the bills for a system that is dysfunctional, ineffective, and broken. We have to change the healthcare system itself. We have to change from a sick care system to a healthcare system, beginning with a sharp new emphasis on prevention and public health and wellness. And that is in this bill, and that's not being talked about by the media. But it is one of the fundamental parts of the health care reform that we are going to be putting through here on the Senate floor and hopefully in conference and to the President by the end of this year. It's got to be comprehensive also. Not everything that deals with wellness and prevention can be done in this bill. For example, very soon we have to reauthorize the child nutrition bill, which deals with school lunches and school breakfast programs. We have to get better food, more nutritious food for our kids in schools and get the junk food out. Why do we have vending machines in schools? Do we have vending machines in schools to provide for more healthy food for kids in school? You know the answer to that. Of course not. So then why do you have the vending machines in schools? So the school can make some money so it can buy band uniforms and maybe football uniforms and things like that? So we get our kids on junk food and high-sugared sodas, which leads to obesity, which leads to diabetes, and all other kinds of chronic illnesses. Do we really want that for our kids in school? So we have to have more nutritious food. So that's the child nutrition reauthorization. Next year, under our committee, I say to the occupant of the chair, who is now a distinguished member of our health committee, we are going to be reauthorizing the Elementary and Secondary Education Act, otherwise known as No Child Left Behind. Well, what about making sure that we leave no child behind also in terms of their health? Right now, we are cutting down on physical activity of kids in school. We're cutting down on recess and times for them to exercise. Well, that's just nonsense. We've got to do more to provide for exercise and healthy food for our kids in schools, because that's where it all begins. Well, to close, Mr. President, Winston Churchill once said something I always thought was pretty much right on point. He said, Americans always do the right thing after they've tried everything else. Well, we've tried everything else in healthcare, and it's failed. It's led us to bad health and the brink of bankruptcy. Let's try something new: wellness and prevention. Time to change the paradigm of healthcare. Recreate America as a genuine wellness society. Let's change the focus. Let's make it easier to be healthy and harder to be unhealthy. Right now, it's easier to be unhealthy and hard to be healthy. Let's change that around. And in doing so, we will build a healthcare system, and we will bend that cost curve. And it's the only way we're going to get the job done.